Hello, my name is Liza, and I'm a third year undergraduate nursing student at the University of Michigan. I'm delighted to speak today about my 2021 summer virtual immersion experience. I attended the University of Michigan School of Nursing's Global Summer Institute, and I had a really great time. My favorite part was attending Dr. Seda Saluk's presentation on maternal care, medical surveillance, and vaccine hesitancy in Turkey, which was part of the Global Coffee and Conversation series. This reflection is going to be about some of the key takeaways for me after I attended the session and did some of my own research. The title of my reflection is Exploring the Role of Nurses and Midwives in Turkey, Contributions to the Reproductive Healthcare Climate. I really hope you enjoy this presentation. To start, here's an image of feminists protesting outside Prime Minister Erdogan's office on May 27, 2012. Protests like this one are actually very common and telling of the largely controversial issue of reproductive health care in Turkey. It's important to establish some context before diving deeper, so I will provide some background about Turkey's healthcare system first. Turkey has universal healthcare with a lot of medical infrastructure already in place. Reproductive healthcare is actually relatively progressive for a country in the Middle East, and abortion is legalized. In the 2000s, Prime Minister Erdogan introduced several policies to promote population growth, including the data system Gabliz, which monitors data about women and reproductive health. This is controversial, with some people believing it to be a democratizing public health mechanism that can provide effective monitoring in order to make providing care more efficient, and others have concerns with privacy and rights violations. There have been several instances where information from Gabliz was leaked to people who didn't have consent to access that information. Additionally, low-income and minority communities are unequally monitored, often experiencing more strict regulations. Now I'm going to discuss the roles of nurses and midwives and how they play a role in the reproductive healthcare system in Turkey. Here is an image of the typical working environment in a health clinic. Instead of nurses providing care, like we usually expect here in the US, many have been relegated to data collectors, calling patients to ask for health information. In general, nursing and midwifery are highly gendered, low-ranked professions where nurses and midwives may feel unsatisfied with their roles. Instead of providing pregnancy care, family planning, education, and counseling services to patients, the main responsibilities are more secretarial work. Some words that nurses and midwives use to describe their role are being a call center worker and police detectives, because they have to persistently collect data or risk getting a salary cut or losing a job. One study showed that 49% of midwives described their job satisfaction as low, and 67% of nurses described their job satisfaction as moderate. Even the title of nurses and midwives has been relegated to family health worker, and many believe that their expertise is not appreciated or respected. What has been done or what can be done about these issues? Let me first explain about the reasons why there really should be efforts to put more value into nursing and midwifery. Here's an image of nurses taking care of a patient during the coronavirus pandemic in Turkey. They made a big difference in Turkey's timely and effective handling of the coronavirus response, demonstrating just how essential the roles of nurses and midwives are in providing quality care. While technology can make information more accessible, it can also come with a lack of privacy if not managed well, causing patients to feel less comfortable with seeking healthcare services. Especially in the case of abortion, studies have shown that women were very careful to avoid a hospital that might disclose their health information. Activists have championed efforts to modify technology to better align with the needs of patients, such as creating privacy buttons to prevent information from being sent to the government. This has made a large impact on the ability and the willingness of patients to seek out care. If bureaucrats and software developers work directly with nurses and patients, they may also further improve the system. Not just for technology, but nurses and midwives can offer valuable insight into improving reproductive health care because they can interact closely with patients, and they can consider issues such as domestic violence and poverty and consider how we could address them. In general, Being more transparent with the public and addressing their concerns could really help encourage cooperation and less dissatisfaction. We need to work together in order to improve the nation's reproductive health care. Finally, and most importantly, investing in nursing and midwifery infrastructure has the potential to decrease workload, improve job security, and standardize care so that nurses and midwives can provide the best quality care. We really need to put value into the professions that can make such a big difference. Thank you very much for listening. I was super appreciative of the experience I've had, and I hope I was able to convey what I learned to you. I have included links to all the resources I explored as I reflected in this presentation. Feel free to read them if you're interested in learning more. I definitely recommend attending the Global Summer Institute if you can, because it's really an eye-opening and fascinating experience to learn about health all around the world. I personally have gained a better appreciation for research in diverse settings and broadened my own understanding of healthcare systems that are different from my own. I will take this into my nursing career, especially as nurses work in such a variety of settings and should always be thinking about how to provide care. Thank you very much.